You're watching ABC4 News.
Welcome back. The COVID-19 vaccine is currently available to Utahns over the age of 70, along with healthcare workers and educators, but eligibility is expanding soon. Today, ABC4's Saray Chen speaks with Dr. Tamara Sheffield about upcoming vaccination options.
We know that there are several new vaccines coming out with approval, and we want to make sure that we're getting the word out about these new vaccines that's coming available on a weekly basis. We have Dr. Tamara Sheffield, Medical Director with the Community Health and Prevention at Intermountain Healthcare. Thank you so much for joining us.
Thank you, Sarah. It's good to be here.
Let's talk about some of these options that are coming down the pipeline. We're hearing new ones on a weekly basis.
Yeah, so right now we have approved the Pfizer vaccine and the Moderna vaccine that are 2 doses, frozen vaccines. We have a new one coming up that's gone to the FDA for emergency use authorization. They're going to be meeting at the end of the month for the Johnson & Johnson Janssen vaccine. It's different in that it's a 1-dose vaccine, and it's going to be much easier to get out of the population because it's refrigerated and doesn't have to be frozen.
And we like that 1-dose option. We have AstraZeneca and Novavax also coming down the pipeline for approval.
Yes, both of those are more in the phase 3 trials. They have not submitted their data yet, so we don't have a lot of information about them, except what we hear about what's going on in Britain with the AstraZeneca vaccine.
There is so much demand right now, and we keep hearing about we don't have enough of the supply, but this is good news when it comes to these new vaccines. Are they effective?
Yes, and so that's the one thing that we want to make sure people understand is that you can't really compare effectiveness because the trials were different, focused on different populations. But in terms of what we wanted to achieve on this, the Janssen vaccine, while it's 72% effective in moderate to severe disease, it is 85% effective on severe disease. And if you go out about 7 weeks after you've had the vaccine, 100% effective on severe disease. And just 4 weeks after getting that 1 dose, it's been 100% effective in preventing hospitalizations, ICUs, and death. I mean, it is doing exactly what we want this vaccine to do, which is protect us from that severe disease.
Well, and especially when there is talk of potential variants coming into the United States, and these are also effective when it comes to that.
Yes, and that's actually one of the nice things is that where the vaccines that we have right now that have such a high effective rate, they were tested before these variants were running around. These new vaccines have been tested in those populations. So here in the U.S., it's 70. You've got that 72% effectiveness. In the UK, where the UK variant's been, it was 66%, and it's actually 57% effective against the South African variants. So that's something that we really want to make sure is that these new variants, it's effective against those too, and we do have evidence on that.
And Dr. Sheffield, once you are vaccinated, and for right now we have the 2-dose in place, what is your suggestion when it comes to masking and quarantining?
It is so important for us to do both. Okay, so vaccination alone is not a good enough strategy, and masking alone is a very effective strategy, but together that's the dynamic thing that is going to change the rates that we have in the spread in our population. So before vaccination, after vaccination, continue to mask, wash your hands, keep our social distance programs going on, because if we get too relaxed, I mean, the modeling that we've seen is if you relax that masking after you've been vaccinated, we will see an upsurge again. We need to make sure we're doing both in order to control this outbreak.
Dr. Sheffield, thank you so much for that important message from Intermountain Healthcare. We appreciate it. And of course, this is for people age 70 and older. And hopefully we're going to see more of the vaccines available for the general public starting in April. Thanks again. For more information, you can go to coronavirus.utah.gov. Thanks again.
Thank you.